welcome back to the Medicare and More program. My name is Kerry Faria. I'm the Assistant Director of the Central Massachusetts SHINE program, and this is my coworker.
Hi, my name's Ed Roth. I'm the Region Director for the Central Massachusetts SHINE program, and we're very happy to be here again, and thank you for allowing us back into your homes. We wanted to talk about a couple of things for this program, and there's some exciting things going on in Central Massachusetts and really in the Commonwealth as far as enrollment opportunities go. As you know, the Medicare open enrollment period ended on December 7th, but this year we have one of our Medicare Advantage plans that is a 5-star plan, and that means that this particular plan can enroll people all year long outside of open enrollment. And Kerry, can you talk to us about exactly what opportunity that may be for folks?
Yeah, I'd be happy to. So what that means when a 5-star plan, it means that this particular plan actually met some very rigorous guidelines from the Centers of Medicare and Medicaid Services. So they performed very highly probably over the last year. And as a result, then Medicare has decided that as an incentive or a bonus for this plan being a high performer, they do allow the plan to have open enrollment year-round. So starting anytime in the beginning of 2016, right through the end of 2016, a person can enroll in this Medicare Advantage plan without any hassles. The only thing you cannot do within this 5-star plan is if you are already in the plan, you just can't switch to a different plan within the same company. So, because if you're already in the plan, you're already in the 5-star plan, so you can't move around. So, Ed, would you like to say which plan got this fantastic mark?
We did mention the name of the plan. It's the Tufts Medicare Preferred Plan. And that's a very reasonably priced option for folks also. It's a plan that really their premiums maintain the same from 2015 to 2016. And their co-pays and stuff really remain the same. They also, a lot of our plans have a maximum out-of-pocket limit, and we've seen it rise the past couple of years in a couple of plans. The Tufts plan continues to have a maximum out-of-pocket limit of $3,400. So again, it's an opportunity that if you missed the open enrollment, you didn't get a plan, or if you had a plan and want to change a plan or something like that, it's not working out for you, this is an opportunity for you to jump into a different plan. So we're very happy about that. And again, you can just call a plan or give us a call at SHINE, and we'll be more than happy to guide you through the process. Kerry, we had a meeting, we had our regional meeting a couple of weeks ago, and we had a directors meeting too, and we had some opportunities where folks can really save some money. So I was wondering if you could talk about that a little bit.
Well, you're probably referring to maybe some what are called special enrollment periods. I'm not sure if that's what you're referring to.
Right, that's what I'm referring to.
Special enrollment periods are special designated periods that Medicare determines that as someone can enroll into a Medicare Advantage plan or can enroll into a Medicare prescription drug plan. So those special enrollment plans, though, are dictated by the Centers of Medicare and Medicaid Services. So what would entitle somebody to having a special enrollment period? Well, one of those things might be based on your income and based on what you have for assets, which is money in the bank, you might qualify for some assistance through the state, or you might qualify for some federal assistance through the feds. With both of those circumstances, if you do qualify financially and you are allowed to get into some programs, then you can have what's called that special enrollment period so you can change your insurance. Another way that someone can have a special enrollment period is if they also are a member of Prescription Advantage. So you've heard us talk about that before. But as a reminder, Prescription Advantage is not a drug plan, okay? So it's not a drug plan. What it is that's another assistance program through the Commonwealth of Massachusetts that just helps somebody pay on their medications. So if you qualify for that, and there's pretty reasonable income guidelines on it, it's pretty high, they don't look at assets. It's a beautiful program. We've had Kathy Devine on the show before to discuss it. If you get into Prescription Advantage, you are allowed one time a year to get out of the current insurance that you're in and get into something else. So that's available as well. So that's a nice feature. There are also special enrollment periods that Medicare determines on a case-by-case basis. Maybe something happens to a beneficiary that's out of their control, something involving the plan that maybe Medicare dictates isn't quite right. Medicare does have the ability on a case-by-case basis to determine whether or not somebody warrants moving to another plan. So if you have any question about any of these situations, please give us a call. That's what we're here for. Again, we've told you many, many times, we're free. We're funded by the government to be able to help you out, the beneficiary, and we'd be happy to help you negotiate if you need a step and how to do that. We'd be very happy to do that.
Yeah, and we want to hear from you. If you have any trouble at all with your drug plan, or you're not getting your proper medications, give us a call. We'll see what we can do, or at least we'll explain the issue to you, and if there's any way we can help you change or clear up the problem, we'll be more than happy to, because that happens sometimes. We recently had a person, one of our clients called, and they went to the pharmacy, and the medication was $100 more than what it was supposed to be. And we were able to work with Medicare and get that situation cleared up, where the client was really able to pay the price that was quoted on the Medicare Plan Finder, which we use as our tool to let people know what their plans are going to cost. It's supposed to be an estimate. We felt that $100 over the price was way too much, so we were able to get that rectified. But if we don't know what's going on, very hard for us to help you. And the main thing we don't want to see people spending their money where they don't have to. And if we can prevent that from happening, to save you some money, it's very important for us to do that. Before we come up today to do the program, had a lady come in and she was struggling. She just lost her husband, and we were able to get her into a program where she could save her Part B premium. Her income was low enough, was below $1,345. She had somewhat limited assets, and we were able to make out an application and fax that in, and hopefully her $104.90 premium will be paid by the state in the near future. So things like that are very, very important to us, that get people in programs if they're eligible, especially senior citizens that sort of economically challenged, and the dollar, we want to get the dollar to go a little bit farther. Speaking of that, we have a couple of special needs programs we wanted to talk about for the next few minutes and go over, and maybe folks might be qualified for some of these programs as well. And they provide assistance to folks at no charge. It's unbelievable. But again, you have to be qualified for these programs and financially. But again, if you are, good deals for anybody that might be qualified. Kerry, can we talk about the SCOs?
Sure, I'd like to. First, one of the programs we're going to talk about is what we call in the business as a SCO. A SCO is what is also referred to as a senior care option plan. And what that is that's kind of a package insurance. So it's a combination of mass health benefits and plus Medicare and drugs all wrapped into one. So the key thing to being able to enroll in a SCO is that you have to be eligible for mass health. Without mass health, you're not going to qualify. So there are a variety of ways to qualify for mass health. It could be because you're finding that you're having more difficulty physically. If you are a certain level physically and you're getting some benefits from the state because maybe you're having troubles getting around the house, you're having trouble showering or bathing or anything like that, you might qualify. So that would open the door for this particular program. So the specifics about the senior care option plan is you have to be 65 or over, you have to income qualify for mass health and have Medicare, and you have to be in the service area of the plan, which is pretty basic. So what do you get out of a SCO? Basically, you have extremely good coverage. When you have a SCO, you should have no co-pays for any of your medical. You're not going to pay anything for it. You'll have no co-pays on your drugs as well. And you won't have to pay for things like dental. Dental's included. There's no co-pays with that. Things like glasses, they're also taken care of by the plan. Those plans help case manage. So if you've got any particular difficulties going on in your life, or you are having difficulty trying to arrange for an appointment or something like that, there's somebody assigned to help you make arrangements and take care of those things. It also includes transportation. It can't get any better than that. So, but you do have to make sure that if you're interested in the SCO, you do have to go to the plan's doctors, and you do have to go to the plan's hospitals, which sometimes people get a little surprised. They think they can still stay with their hospitals and their doctors, but they're going to have to move to what the plan dictates. So, but a senior care option plan is a really, really good benefit. For a senior care option plan, a person can be perfectly healthy. You can be living at home, can have very little going on with you health-wise. Again, probably the key is you got to be over 65 and you have to have limited income and assets. But other than that, it's a really, really good option. So there's another program we could talk about. What is also another special needs program?
The PACE program is another program that's very good. The qualification for that is you have to be 55 years old. So the age is a little bit lower. And for the PACE program, you need to be a little more frail, you need to have more needs. You need to have needs a level that you may be eligible for a nursing home. And what the PACE program will do, the goal of it is to really get you services in the community where you don't have to go to the nursing home. Eligibility for that program is Medicare, again, and Mass Health. But if you just have Medicare, you can get into the PACE program, but it's going to cost you money to get in. You're going to have to pay a premium. But if you have Mass Health, that will cover both ends of the services that are provided by the PACE program. That includes daycare. You can go out and get daycare services. Includes in-home. Includes an awful lot of things that you can really use. It's a very useful program. Again, if you have Mass Health and Medicare, no charge for any of these services. It includes dental, it includes about everything, but it's network-based also. You got to stay in a network, and the services are provided through that network. It's significant here in this area. The one program we have in the Worcester County area is a Summit Elder Care program that's done by the Fallon Senior Plan folks. But again, a very good program, and the PACE program is one of those programs that is really very helpful. Not enough people, I think more people can use it. Give us a call if you feel yourself or one of your relatives, or if you're a caregiver, you think the PACE program might be helpful to the person you're caring for or your loved one. Give us a call about any of these programs, the SCO programs as well. Give us a call and we'll talk you through it, see what your needs are, and if you're eligible, we'll see if we can get you hooked up with and get you into the program. It's another great programs. These are great programs that are available for our seniors that we're not seeing probably enough people. There's a lot more people qualified for them than are in them, and maybe there's a resistance because you have to see a network of doctors, but I think there might be some other stuff going on. Could be simply a lack of knowledge that the programs even exist. And that's another thing we want to do, and we have to do through our program here of Medicare and More to get the information out to folks. And we should, hope we're doing that. That's our goal. Kerry, what else do we have going on right now in the area and can help folks?
A couple of things we've been talking about in the office we really want people to be aware of is that, again, we use the Medicare Plan Finder, which is a tool that you can use through Medicare.gov, which helps people to determine which is the least expensive Medicare drug plan for an individual. What we've found, and Ed alluded to it earlier, is cases where the information that is on the Plan Finder, and at least what we've been running into so far, is, for example, like copays on medications that are low and that show that they're really, really low on the Plan Finder, but when the person goes to a pharmacy, they're finding that the copay for that medication is significantly different, okay? So that is a bit of an issue. We have an issue with that. We have brought that to Medicare's attention to let them know that we're seeing those discrepancies. So far, we've been told that those discrepancies are okay because the Medicare Plan Finder is an estimate. But we would encourage people that if you are seeing any really big discrepancies, nothing small, but if you're seeing really big discrepancies at how much you pay when you go to the pharmacy, it would be good to give us a call. Excuse me. Because if we don't start getting feedback on some of these things that are happening out there, then the situation may not get cleared up. So we do want to hear it, for example, as we gave an example, in a 30-day supply, the plan finder said a medication was $7.48. The person went to the pharmacy and they picked it up and it was $112. So part of the issue that's going on that we were made aware of is that different drugs are obviously made by different manufacturers. And it depends on which manufacturer that the pharmacy has a contract with and they buy their drugs through. So you could have one drug that's made by 10 different manufacturers, okay? But they all have different pricing. And the pharmacy may only buy from the same medication from 2 or 3 manufacturers. So whatever the pharmacist pulls off the shelf and fills your medication with, you know, that's the price you're going to pay. And then those specific manufacturers and the pharmacy themselves has a contract with the drug plan. So it can get really complicated very quickly. So, and we've never had as many issues with this as we are having recently. It's kind of a new thing. So it's something we want to keep an eye on. So again, if you're noticing big price differences, I'm not talking a couple of dollars, I'm not even talking $10, that doesn't scare me a whole lot, because again, Plan Finder's an estimate. But if you're seeing something really big, we'd really like to hear about that. You can also call us, you can also call the Massachusetts College of Pharmacy. They work on these sorts of issues as well. But to actually make a change within Medicare to correct some of these things, we'd like to hear that. I'd like to hear that, because then we can let Medicare know, and let's see if they can address the issue. With this particular case I was talking about, Ed mentioned, and I was just referring to about this medication difference, we actually went to the Medicare Ombudsman and kind of pushed it up the chain a little bit to see if we can get some of that resolved a little bit.
Yeah, and what we do, and the fact of the matter is, we all complain. Medicare is a bureaucracy. What can we do about it? Well, Medicare is very, very proactive in a lot of these situations. For instance, if we get a complaint, we can send Medicare a complaint tracking form and a complaint tracking form or something like that, and they'll investigate the situation. Okay, and normally, depending upon what your situation is, maybe you have only 2 days of medications left. They'll resolve that situation within 24 hours, or they're supposed to anyway. Now, if you have a little more left, might take 7 days. But they have a criteria where if we send in a complaint about a drug plan or about a Medicare Advantage plan, they'll resolve that in a brief period of time, so that you'll get your meds if you need them, and you get your plan to work properly if you need. I will get an answer why it isn't. So Medicare, although it is a bureaucracy, painful sometimes, but it really does respond to complaints from their beneficiaries. As a matter of fact, we have seen most recently a couple of rather large drug plans that one in particular has been sanctioned. And when Medicare sanctions a plan, that means that nobody can join that plan. And that can be very costly. As a matter of fact, the plan is taken off of the Medicare Plan Finder completely. So nobody can join that plan. And they've suspended one plan. And I'll mention the plan's name, but it's a Cigna plan. And Cigna in Massachusetts, we have a couple of drug plans that are managed by Cigna. Now, don't panic. If you have a Cigna drug plan, it's fine. But unless something happens and you call us, we can check it out. But you don't have to jump out of the plan. Just you can maintain your membership in that plan. But again, what Medicare does, they've found that they've really used some harsh language, and things may be going on in other parts of the country. But they've found that plan is really not performing very well at all, so they've sanctioned the plan.
So it's an incentive for the drug plan to kind of recollect, get themselves organized, fix the issues internally, and then they can go back to fully be presented by the Medicare Plan Finder. So if somebody was still interested in SilverScript and still wanted to purchase that particular drug plan, you can. You just need to call the plan directly, or you need to go to the plan's website directly, and there it will show all the information that you're looking for. So on the website, or if you give them a call, they'll tell you how much the plan will cost per month. They'll tell you about the co-pays. They'll tell you what it's going to cost for the year, information like that. So SilverScript is still available. It's just not going to, again, be available on the Medicare Plan Finder, which is kind of the nationwide tool we use to figure out drug plans for individuals. So to just go back to Cigna, they're completely off the market. So, and that's off the market nationwide. So any of their Medicare products, whether it's a Medicare Advantage plan, which are available in other states, not Massachusetts, there isn't even a Cigna Medicare Advantage plan in Mass. But again, as Ed said, there's a couple of drug plans that they did have in Mass, but now they've been taken off the market. Again, it's a disciplinary action. So Medicare takes it very, very seriously that if a plan is not performing accordingly and it's not in compliance with the rules of what Medicare states, there are different stages of discipline, and that's what's happening right now with those particular plans. So once they get their things back together again and they're back in compliance with Medicare, we may see them back on the market again pretty soon, at least the Cigna. SilverScript still is, you just can't find their information on the Plan Finder, so for the time being. And just so everybody knows as well, Medicare has not issued special enrollment periods for those beneficiaries that are in those plans. So Medicare has not said, okay, you're in Cigna, you can switch to a different plan. They haven't said that. So if you're currently in a Cigna plan, unless you get a different special enrollment period, again, like the ones I had mentioned earlier, you're not entitled to move plans at this moment. So you're going to be in that Cigna plan through 2016.
There's not a general special
No.
enrollment. But on a case-by-case basis, if you feel you've been in a Cigna or a SilverScript plan, you feel if you've been treated unfairly, there's something wrong, please give us a call and we can check it out for you. That's what we're here for. We don't want you to settle for less. If you think if things aren't going well for your plan, let us know. Give us a call and we'll see what we can do for you. It's important to us, but it's important to you too, because we want to make sure that you're getting what you deserve and not and really not anything less. I feel it's just so important. It's a means of this program. Also, what I want to try, and I didn't even mention this to Kerry, but we've been doing this program now, I think, for about probably done 12 or 15 programs, and we probably want to get them on a more regular basis so you're not watching the same program all the time. But we're going to strive to do that. What we'd like you to do, if you have any issues at all, anything that you think might be a good topic for our program, maybe you can either give us a call and mention it to us, and the number's on the screen, or go to our website, shinema.org, www.shinema.org. That's also up on the screen. And shoot us a little email. You can do it through the website. And if you've got a question you feel might be a good general question or a good general topic for us to talk about, we'd be more than happy to talk about. We've gone through a lot of topics, but we might be missing something that might be a good topic, and no better way than to get the folks that are out there working with their Medicare programs and Mass Health programs, and there's no better way to get information out, to get input from you on our program. So that's a new twist for you. If you feel that there might be a good topic for you, give us a call, shoot us a little email through our website at shinema.org, and again, we'll be happy we'll take a look at it, we'll mention it, we may do it, we may do a little bit on it, or we may not, but we'll get back in touch with you anyway. Kerry, anything else you want to chat about?
Sure, since I wasn't aware of this earlier, my only thought is it can't be random, okay? It's got to be about a Medicare subject of some sort. General,
well,
Medicare.
That's what I did say, general.
Medicare, right.
Not
so it can't be about, I can't even think of something at the moment, but it's got to be a Medicare-based question or something around benefits, different programs that we talk about. So it's got to be related to that. So we'd be happy to, as Ed had said, if we can have a program about that, we'd be happy to do so. So anything else on the docket coming up in the next
Well,
few
within
months?
the next month or so, we're going to have one of the veterans agents in to chat about veterans benefits. That's been a subject that's been dear to me for a long time. But hopefully we can do it in the next program, probably in March. And we're going to have one of the veterans agents in and talk about in particular Chapter 115 benefits. Chapter 115 is a Massachusetts law that provides benefits to folks, to veterans, and veterans' widows also, if their income is below 200% of the federal poverty level and their assets are below a certain level. And what Chapter 115 can do, it will pay all of your medical, pay your bills. It'll pay for your health insurance program. It'll pay your co-pays. It'll pay for your Part B program. So again, it's a very, very enriching program. But again, the qualifications are 200% of the federal poverty level and assets. I'm not too sure about the asset level, but we'll certainly be able to talk about it with the Veterans Service Agent. And they'll go over also some of the federal benefits. But again, the Massachusetts programs, particularly Chapter 115, is a program that we think an awful lot of people are missing out on. So it's something we really want to help folks with and get folks, particularly some of our widows that are out there struggling, that are eligible for this program. Kerry, I think that's about it for today. I want to thank all of you for having us in. It's a beautiful, beautiful, beautiful winter day, if you want to believe it. But thanks again for having us, and we look forward to seeing you next time.